As a specialist physician who has dedicated many years to working and conducting extensive research on spinal conditions, I've observed a health issue that, while quite prevalent, is frequently misunderstood or underestimated in its severity. Vertebral compression fractures, VCFs, often simply referred to as a collapsed vertebra. This isn't just a regular backache. A spinal compression fracture is a serious condition that can profoundly impact one's quality of life, mobility, and even longevity. Many of my patients have faced immense challenges from this condition, ranging from persistent pain to the loss of independence in their daily activities. In today's in-depth analysis, we will thoroughly decode spinal compression fractures, from the root causes that lead to this condition, how it negatively affects your life, to the most effective prevention strategies based on scientific evidence and my clinical experience. The goal is to equip you with the essential knowledge to protect your spine, or at least recognize early signs and take timely action. Join me as we delve into understanding our amazing spinal column and how to keep it strong and resilient. Basic spinal anatomy, the body's pillar. To understand vertebral compression fractures, we first need a basic understanding of spinal anatomy. Our spine is a complex and flexible structure made up of 33 vertebrae stacked one upon another. These vertebrae are categorized into regions: cervical, neck, thoracic, upper back, lumbar, lower back, sacrum, and coccyx, tailbone. When we talk about spinal compression fractures, we usually focus on the thoracic and lumbar vertebrae, as these are the regions that bear the most weight. Each vertebra has a cylindrical body, vertebral body, and a posterior arch that protects the spinal cord. Between the vertebrae are intervertebral discs, which act as shock absorbers, providing flexibility and load-bearing capacity to the spine. The spinal cord runs inside the vertebral column, serving as the communication highway from the brain to the rest of the body. The main functions of the spine are supporting the body. The spine bears the entire weight of the upper body and transmits force down to the legs. Protecting the spinal cord. The bony arch of each vertebra forms a protective canal for the spinal cord against external injuries, allowing movement. Thanks to the vertebrae and discs, we can bend, twist, and perform complex movements. When a vertebra is compressed, it means the vertebral body has been squashed or collapsed, often more so in the front, forming a wedge shape. This not only causes pain, but also directly affects the spine's ability to bear weight and maintain its natural curvature. Causes of spinal compression fractures. Why does the pillar collapse? A spinal compression fracture is not a random accident. It's often the result of one or more factors that weaken the bone structure, making it unable to withstand normal pressure or even minor trauma. A. Osteoporosis, the leading culprit, accounts for 70 to 80% of cases. This is the most common cause and why we as physicians constantly emphasize the importance of bone health. Mechanism. Osteoporosis is a condition where bone density decreases, making bones porous and brittle. Imagine your bone like a sponge. When healthy, it has a tight structure. With osteoporosis, the empty spaces within the sponge grow larger, making it significantly weaker. Vertebrae, especially their bodies, contain a lot of cancellous, spongy bone, which is naturally more porous than the outer cortical bone, making them particularly vulnerable to osteoporosis. Impact. When bones are weakened by osteoporosis, even minimal force can cause a compression fracture. This can be due to everyday activities. A strong cough or sneeze, a misstep, lifting a light object, or even just a sudden twisting motion can be enough to cause a vertebral collapse. Minor falls. A fall from standing height can cause multiple fractures, including spinal compression fractures. At-risk individuals. Postmenopausal women, due to estrogen decline, elderly individuals in general, long-term corticosteroid users, those with a family history of osteoporosis, and individuals with sedentary lifestyles or insufficient calcium vitamin D intake. B. Acute trauma. While osteoporosis is the most common cause, even individuals with healthy bones can suffer spinal compression fractures due to severe trauma. Mechanism. High-impact forces that exceed the bone's tolerance, such as motor vehicle accidents. Severe collisions, especially when belted but the upper body is jolted forward. Falls from significant heights, falling from a roof or down a flight of stairs. Sports injuries. High-impact sports with direct trauma. Characteristic. In these cases, the bone was not pre-weakened. The force of impact is simply too great, causing sudden compression and structural failure of the vertebra. C. Metastatic or primary tumors. Cancer can be a formidable cause of vertebral compression fractures. Mechanism. Primary tumors. Tumors that originate directly within the bone, very rare. Metastatic tumors, much more common. Cancer cells from other parts of the body, often breast, prostate, lung, kidney, thyroid cancer, spread to the spine. These cells destroy normal bone structure, making the vertebra weak and prone to fracture, sometimes with only a slight movement. This is known as a pathological fracture. Characteristic: pain is often persistent, doesn't improve with rest, and may be accompanied by other cancer-related symptoms. D. Infections. Infections can also weaken bones. Mechanism. Bacteria or fungi can invade the vertebral bone, vertebral osteomyelitis or intervertebral discs, discitis, causing inflammation, bone destruction, and weakening of the supporting structure. Characteristic: often accompanied by fever, chills, severe pain, and may have a history of infection in other parts of the body. E. Other medical conditions. Several other medical conditions or factors can indirectly or directly cause bone weakening. Long-term corticosteroid use. These medications, often used to treat arthritis, asthma, or autoimmune diseases, can decrease bone density and increase osteoporosis risk. Multiple myeloma, a type of blood cancer affecting the bone marrow, which weakens bones and causes lytic lesions. Paget's disease of bone, a chronic disorder of bone remodeling leading to enlarged, weak, and brittle bones. Rare genetic bone disorders. Certain congenital or inherited conditions can affect bone development and strength. 3. Impact on life. When the pillar is no longer stable, a spinal compression fracture not only causes pain but also has profound consequences, affecting every aspect of a patient's life, from daily quality of life to long-term physical and mental well-being. A. Pain. Acute pain. This is the most prominent symptom. The pain often starts suddenly and is severe at the site of the fractured vertebra, potentially radiating to the front of the chest or abdomen. Pain typically worsens with standing, walking, or changing positions, and may decrease with lying down. Chronic pain. Approximately 1/3 of patients continue to experience persistent pain, even after the acute fracture has healed. Chronic pain can result from spinal deformity, pressure on surrounding muscles and ligaments, or nerve damage. Chronic pain significantly affects sleep, mood, and the ability to perform daily activities. B. Spinal deformity, kyphosis, dowager's hump. When multiple vertebrae are compressed, especially in the thoracic region, the spine tends to curve forward, creating a noticeable hunched posture. This is not just a cosmetic issue, but also alters the body's center of gravity. Loss of height. Each compressed vertebra can lead to a height loss of several millimeters to several centimeters. When multiple vertebrae are involved, total height can significantly decrease, e.g., losing 2 to 4 inches or more. Consequences of deformity. Respiratory restriction. Severe kyphosis can reduce lung capacity, causing shortness of breath, especially during exertion. Gastrointestinal issues. The compression of the ribcage and abdomen due to kyphosis can impinge on digestive organs, leading to indigestion, bloating, constipation, and early satiety. Balance problems. Altered body mechanics increase the risk of falls, particularly in older adults. Body image issues. A hunched posture and height loss can make patients feel self-conscious and socially withdrawn. C. Reduced mobility and independence. Difficulty with daily activities. Pain and spinal deformity reduce the ability to perform simple actions like bending, lifting objects, walking, standing upright, or even dressing and personal hygiene. Reduced social participation. Fear of pain or falls makes patients less likely to engage in outside activities, leading to social isolation. Loss of independence. Many individuals require assistance from others for basic activities, diminishing their autonomy and impacting their psychological well-being. D. Psychological and social impact. Depression and anxiety. Chronic pain, loss of mobility, and changes in appearance often lead to depression, anxiety, and feelings of helplessness. Fear of refracture. The dread of a new pain episode or another fracture can cause patients to excessively limit their movements, even when it's not always necessary. Reduced quality of life. The cumulative effect of these factors significantly diminishes the patient's overall quality of life. E. Neurological complications. Less common but serious. Although rare, in some severe cases, a compressed vertebra can impinge on the spinal cord or nerve roots. Consequences: this can cause neurological symptoms such as muscle weakness, numbness, tingling, loss of sensation in the legs, or bowel-bladder dysfunction. This is a medical emergency requiring immediate intervention. F. Increased risk of future fractures. Alarmingly, one vertebral compression fracture significantly increases the risk of subsequent vertebral compression fractures, as well as other osteoporotic fractures, e.g. hip fracture, wrist fracture. This creates a cascading effect of fragility fractures. 4. Prevention of spinal compression fractures. Protecting your pillar. Preventing spinal compression fractures is a multifaceted strategy that focuses on optimizing bone health, managing underlying medical conditions, and minimizing the risk of falls. As an expert, I always emphasize that prevention is the best treatment. A. Optimizing bone health. This is the most crucial foundation, especially for preventing and treating osteoporosis. 1. Proper nutrition. Calcium, the building block of bones. Adults generally need around 1,000 to 1,200 milligrams of calcium daily. Good dietary sources include dairy products, milk, yogurt, cheese, dark leafy greens, kale, broccoli, sardines, salmon, tofu, and calcium-fortified foods, cereals, orange juice. Vitamin D, the key that helps the body absorb calcium. Adults typically need 600–800 IU of vitamin D daily, or more depending on deficiency status. Primary sources are sunlight exposure, safe exposure, fatty fish, salmon, mackerel, egg yolks, and vitamin D supplements. Other nutrients, magnesium and vitamin K2, also play important roles in bone health. They are found in nuts, green vegetables, legumes, and chicken. 2. Regular physical activity. Weight-bearing exercises, brisk walking, jogging, jumping rope, dancing, climbing stairs. These activities stimulate bone cells, helping to build stronger bones. Strength training, using weights, resistance bands, or bodyweight exercises to build muscle, which in turn supports and protects bones better. Balance exercises. Tai Chi and yoga help improve balance, reducing the risk of falls. Note, if you have been diagnosed with severe osteoporosis, consult your doctor or a physical therapist for guidance on appropriate exercises to avoid twisting or excessive bending motions that could be harmful. 3. Healthy lifestyle. Quit smoking. Smoking reduces bone density and impairs bone formation. Limit alcohol consumption. Excessive alcohol interferes with calcium and vitamin D metabolism and increases the risk of falls. Caffeine moderation. Excessive caffeine intake can increase calcium excretion, though the effect is usually minor if dietary calcium intake is adequate. Maintain a healthy weight. Being underweight or overweight can negatively impact bone density. B. Screening and treating osteoporosis. This is a critically important step for at-risk individuals. 1. Bone density scan, DEXA scan. This is the gold standard for diagnosing osteoporosis and assessing fracture risk. Women over 65, men over 70, and younger individuals with risk factors, e.g. family history, long-term corticosteroid use, should be considered for a DEXA scan. 2. Consult your doctor. Regularly discuss your medical history, family history, and risk factors with your physician. 3. Osteoporosis medications. If you are diagnosed with osteoporosis, your doctor may prescribe medications to slow bone loss or even help rebuild bone. Common drug classes include bisphosphonates, e.g. alendronate, risdronate, slow down bone breakdown. Denosumab, e.g. Prolia, a monoclonal antibody that reduces bone resorption. Teriparatide, Forteo, or abaloparatide, Tymlos, synthetic hormones that stimulate new bone formation. Romosozumab, Evenity, a dual-acting medication that both increases bone formation and decreases bone resorption. C. Fall prevention. For older adults or individuals with existing osteoporosis, falls, even minor ones, can cause vertebral compression fractures. 1. Improve home safety. Remove tripping hazards, loose rugs, cords. Ensure adequate lighting. Install handrails in bathrooms and on staircases. Use non-slip mats. 2. Regular vision checks. Ensure clear vision to prevent stumbling. 3. Medication review. Discuss with your doctor any medications that might cause dizziness, drowsiness, or affect balance. 4. Appropriate footwear. Wear shoes with good support and non-slip soles. D. Managing underlying conditions. Strict control of diabetes and hypertension. While not direct causes of VCFs, unless severe vascular complications, managing these conditions well improves overall health and mobility, indirectly supporting bone health. Monitoring and treating cancer infections. If there's a history of cancer or bone infections, adhere to treatment plans to prevent metastasis or bone damage. Medication awareness. If you are on long-term corticosteroid therapy, discuss bone protection strategies with your doctor, e.g., calcium vitamin D supplementation, preventive osteoporosis medications. Never self-medicate without a doctor's prescription, especially with drugs that can affect bones or kidneys, which also impact bone health. 5. Conclusion. Spinal compression fractures are a serious health issue that can cause severe pain, spinal deformity, reduced mobility, and profoundly impact quality of life. The leading cause is osteoporosis, but trauma, tumors, and infections should also not be overlooked. However, with the right knowledge and proactive measures, most osteoporotic compression fractures are largely preventable. Optimizing bone health through nutrition, exercise, timely osteoporosis screening and treatment, along with fall prevention strategies, are key to protecting your body's pillar. Don't wait until your spine cries out. Be proactive in protecting your bones starting today. If you have any risk factors or are experiencing suspicious symptoms, do not hesitate to consult a specialist for timely advice and examination. Strong bone health is the foundation for an active and quality life. Cherish and take care of it.